So it's nice to have everybody here again tonight on our Wednesday webinar series. If you've had a chance to join us at our other webinars, tonight we are actually going over a specific topic that's actually something near and dear to my heart, specifically towards education and understanding kind of the procedural safeguards. So if you've ever been, at your child's IEP meeting or Section 504 meeting, and the staff hands you this packet of papers that says, here are your procedural safeguards, we gave them to you, right? And that's all they have to do is just say, yep, we gave them to the parents. But the problem is that if you were to try to read a lot of that jargon, it is a lot of heavy words, and it's really hard for some parents to understand what their rights are. And what they need to have so they don't know. Like one of them I had shared before is that you can look at your child's educational record and go right down to the superintendent and ask to see it anytime you want. You don't have, you can just ask. And you have a right to see your child's educational record. So again, and you can go in and read everything in there that is privy to you, all that information. So we have New Hampshire Family Voices here tonight. So excited to have them. We've worked with them for many years prior. So I'm so excited to have them here with us tonight. I am going to go ahead and just kind of do a quick introduction of who they are, in case you don't know. So New Hampshire Family Voices provides information, training, and resources so children with special health care needs can go get what they want to thrive. Their founding members were actually parents, and to this day, the majority of the staff are individuals and family members with lived experiences. They involve families, amplify their voices, participate in program development, and share expertise to influence policies that impact children. New Hampshire Family Voices connects families of children and youth with special health care needs and disabilities to the resources that they require and provides vital information to help them access the services and support they need to thrive. One thing I want to just kind of say is that New Hampshire Family Voices, I know we have that NH, New Hampshire in there, but they would help anybody in any state connect you with the resources that you need for it. And when we talk about tonight about your procedural safeguards are not just privy to New Hampshire or to Maine or to Rhode Island or Vermont and Mass. It is a federal piece. So that means every state has these. So this is going to be something that impacts every one of our families that have children with disabilities in all of the states we service. So I'm going to pass the torch over to Maureen and to Jennifer from New Hampshire Family Voices. And thank you so much for being here tonight and sharing something that is so near and dear to my heart.
Great. Well, happy to be
Christine,
here.
can I have the, whoops, sorry, Maureen, can I have the ability to share?
You can. I'm going to make you co-host.
Perfect. Thank you.
Jen's my technical person for the evening, but I'm really happy to be here. I was I work for New Hampshire, the Parent Information Center, which has New Hampshire Family Voices, and Jen kind of works for both agencies, but I work particularly in the area of special education and supporting families through the special education process. We provide families an intake line where you can call us at any time if you have any questions about your IEP team or what's going on in the process, or whether or not you're thinking of making a referral to special education for your child, or what's a 504. So all these types of things, we're available to provide intake line. You can give us a call. We usually get back to you within 48 hours. And you can call us as many times as you want. And we often, if parents are having, somewhat of a back and forth with their school, they might call us several times and we can kind of help them through that. We also offer online training. We offer virtual trainings like this all the time for our parents. Usually, I always tell people to check our website, which is picnh.org, under the events tab, and you'll see what workshops we have. So we're always looking to try to provide knowledge to families about how they can advocate for their child at that IEP meeting. What rights do they have when it comes to advocating for their kids? So tonight, I was going to kind of walk us through a basic overview of the special education process. And I'd love to keep it very informal. So if you folks would like to, if you have any questions, you can put it in the chat. And we've got a few people monitoring the chat, so you can just stop me and we can answer the questions as we go along, if that would be helpful. And then we should have a little time at the end for more questions too. So definitely feel free to jump right in there, because once I get on a roll, to have no problem stopping me, okay? Great. So our next slide, just a little bit about us. So this is a little bit about PIC and New Hampshire Family Voices, and I think we just kind of covered that, so we're all set. And a little disclaimer about the Parent Information Center. When you do call us, we do have knowledge of special education laws and rules, but we are not attorneys. So we want to make sure that everybody calling us realize that we are to provide information and resources to families. So just a little disclaimer to throw in there. Then the next one. Is this just about IEPs and 504 question in the chat? We are going to talk, pretty much tackle about IEPs and all the rights and responsibilities that parents have and families have in that process. Okay, so tonight, what we'll learn about the steps in the special ed process, we'll just go through that because, as we were mentioning at the beginning, the procedural safeguards are all about your rights and responsibilities. And they are given at every meeting. And I always encourage parents, they offer them to you every meeting. Always say yes, because they can change. And you never know when they're going to change. And they just changed recently. They added some new information to it in 2024. So always say yes. Schools have to post it on their website as well. But I can remember I have 2 kids that were on IEPs from the time they were in first grade all the way through high school. And one of my kiddos has a seizure disorder. So it was challenging. They both had learning disabilities as well. And for me, I think the first time I saw the procedural safeguards, I got really concerned. I was like, wow, why is everybody disagreeing with everybody? What's going on here? Like, it was just, I had this really nice group of people at an IEP meeting that I was meeting with that were all ready to help my child and support us. And then all of a sudden they hand you those safeguards and you're kind of like, wow, what's this all about? Like, are we going to be arguing? That's what I think of when I think of safeguards. So, but we're going to talk about how important those rights are, because as a parent, you are a huge part of the IEP team and you have certain rights. So we're definitely going to get into that tonight and what we can, kind of ask for in the school and really how to advocate for our kids. So we're going to learn about the steps in the process, the rights, some important documents and some timelines, tips and strategies for effective communication, and resources that will support you guys too as you're going through this. Okay. So to be an effective advocate for your child, you need to remember that you know your child best. I think what happens to us sometimes, and I can speak for myself here, when I first went into an IEP meeting and there were all those people at that IEP meeting, I was very intimidated because I wasn't an educator myself. So I really felt like I really wasn't on a level playing field with these people. And I had no idea what special ed was. I had no idea what an IEP was and evaluations and things like that. So I was very quiet at first, very quiet, kind of just sat back and nodded a lot, didn't have a lot of questions, had a million questions, but I didn't even know where to start. So I used to, I could say that I was probably pretty passive at first, just kind of thinking, these are the professionals, they're educators, they know what they're doing. And I felt like the IEP was really their document, not mine. So I very quickly learned that that was a bad way to play the game. So I realized that once my kids started going through school, I had great teams, nice people, but they just weren't making progress. And we were getting deeper and deeper and further behind. And that's when I reached out to the Parent Information Center and I did a training. And all of a sudden I had that big aha moment. And I thought, I got to get more involved here. Because number one, I know my children best. We all know our children best. We know how they learn. We were their first teachers. So you can't undersell the importance and the role that you have in their education going forward. Also, like I said, I reached out to PIC because a neighbor told me about them. I had no idea about them. This was probably about 12 years ago. and then got trained by them, and things really changed because it opened up this whole new, this resource door to everything. And I could just get more educated on my kids' learning disabilities and how that affects and impacts their education. Um, Also, definitely know your rights and your responsibilities, and also how to use clear, effective, positive communication. This can get really personal, right? We're dealing with our children, especially if our kids are struggling and we feel like they're not getting the access that they deserve or that's entitled to them. So it can get very personal. And often I work with a lot of families on the intake line. So I'm often first talking to them about, okay, it's okay. Let's handle this like a business call, right? Let's get our data together. Let's talk about how we're going to approach this meeting. So I do a lot of coaching like that with families because it's hard to not really take it personal. Next slide, Jen. So again, you guys know your child the best, the character of your child, how your child learns the best, what their educational history is. The other thing is IEP teams and 504 teams change every year, but you are the one constant on that team. You're the one that knows the educational history. You're the one that knows the developmental history and the social and emotional history and the medical history. So you are really playing a key role. And every year you're kind of bringing that knowledge and educating a new team of teachers and administrators on an IEP team. So I always tell parents, get that elevator speech about your child. And of course that changes every year because they're developing, they're growing, they're getting older. So, but definitely you are definitely the key role in that. And the next screen. So some resources here, and PIC is great. Our Center for Parent Information and Resources, which is our, the Parent Information Center is federally funded, and there's one in every state. And then there is one that oversees all of us in the US, and that's the Parent Resource Center. Great place to go for information. Also, a few other ones that I put out there, National Family Voices and NAMI, and a few other really good supports in our state. And of course, you guys. All right, next slide. So who else can help support with questions or offer support? So another key thing is for parents to know you don't have to go it alone at that IEP meeting. If you have, if you're working with a doctor, a neurologist, you're working with a therapist, if your child's working with any outside therapists or support, those people can also provide input to the IEP team. Because instead of, often we have our kids and they might be working through some issues and maybe they have very high anxiety or they have a therapist that they're working with. It's good to have that person's input with the IEP school team and the 504 team so that we're all on the same page. So definitely bring in whatever support you'd like to. And you don't have to go to that meeting alone. So you want to make sure that you have somebody good. For myself, I always needed another person because I could not take notes and try to talk and go through all of my concerns at the meeting. So it was always helpful to have that support person. So next slide. So another big thing I hear from parents when they first get into the special education process is they walk into the meeting and they cannot believe how many people are there. And then right away, they feel very intimidated, right? No need to, because by law, certain people have to be at that IEP meeting. Sometimes parents, I think, feel, oh gosh, I'm getting ganged up on because they had 10 of them and it was just one of me. But by law, there has to be the parent, the LEA representative, which is the local education agency. That's the person that's representing the school district. And then you have not less than a child's regular ed teacher and a special ed teacher. And it's funny because you think they're representing the school, but they're not. They're actually representing the student at that meeting and the child. And then we have the individual who can interpret instructional implications of evaluations. So if your child is being evaluated and you're going to be going over some testing scores, there needs to be somebody at the meeting that really can interpret those testing scores. The child, when appropriate, always encourage families that if your child is willing and would like to go into the meeting, I think it's a great idea. because it doesn't matter what age. In high school, by law, they have to be invited to come to the meeting when they're talking about their goals for life after high school. But even when kids are really young, I think it really builds really nice advocacy skills in kids. And they don't have to attend the whole meeting. Maybe pop in for the first 10 minutes, tell everybody how they're doing, how are things going, what's working well, what they might need a little help with, what's a concern they're having. And I just think it gets kids used to going to their IEP meeting, and it kind of also makes them feel like they are being supported. You know, they've got a team of people there that really want them to be successful. So a child, when appropriate, other people's invited by the parent or the school can come. And going back to that LEA representative, just so you know, that's the person, like I said, representing the school district, but they're the person at the meeting that is there to make sure that whatever the IEP team decides for the student, that the school district is ready to appropriate funds for that service. Okay, so that's their job, is to make sure that whatever we decide for services for that student gets implemented and set up. Okay, next screen. So a couple of things, and this is where those procedural safeguards talk about this. They know it has your rights and responsibilities. You have the right to participate in all of your child's IEP team meetings. And those meetings should be at a mutually agreeable time, and giving parents also the benefit to participate. So this gets a little tricky, because if your school district is the type that likes to do meetings on Tuesday at 11:30, well, if you're a working parent, an 11:30 IEP meeting or a 10 o'clock IEP might not be the best. But so you can always feel free to say to the team, we have an IEP meeting come up. These are the days I'm available, and these are the best times, and give them a couple of different options. Okay. Understand the steps in the special ed process, understanding your rights as a member of the team, be an active member of the team, which is very important. And we'll talk a little bit about how you guys can kind of prepare for a meeting ahead of time. And make informed decisions for your child. You know, make sure that you've got the information, and you can go in there and you can request things and really be an active member of that team. And you can also request an IEP team meeting at any time. So if your child is particularly struggling, or if they've had a medical event recently, you know, if they've had a seizure, or if they've had some sort of medical event, or we've got new outside information, maybe from a medical doctor, to update the team, you can request an IEP team meeting and pick on our website. We have a resource tab. Click on that, and we've got a slew of sample letters to request things from your IEP team. We always recommend everything go in writing, because when it's not in writing, it has a tendency to get very lost in the schools. So we want to make sure that we have a data trail that we requested this meeting, because it also kicks off a 21-day time limit. So the school has to respond to you within 21 calendar days. So we want to make sure we deliver it in writing. Everybody sees that you're requesting a meeting, and the meeting gets scheduled right away. Any questions? I see the chat's going up. Is there any questions in there that I could tackle now before we roll on? No? Good. Okay, great. All right, next slide. The next slide, and there's the procedural safeguards. So for those of you who are talking about that packet, right there it is. And I even laughed because I had an old photo. Like I said, it was just updated in I think it was December 2024. So the procedural safeguards, basically they're giving these to you at the IEP meeting. They don't have to give it to you at everyone, but they do have to give it to you annually. And it basically tells you these are your rights, and this is all, kind of explains some of that documentation we get too. So you're allowed to participate in every meeting. You can access your child's educational records at any time. Often, especially when our kids get going, we've got a lot going on, a lot of evaluations, a lot of testing. Sometimes that gets away from us, right? And we don't know what's been going on. We haven't seen any progress reports. So you can request to see your child's educational records. we have a sample letter for that too. It takes 14 days for the school to reply to that. Usually they do it pretty quick. And then you can go in the school and inspect the records and look through everything, take pictures, or make copies of the records for your own self, because it's always good to have your own files. The procedural safeguards also say that students and families are entitled to an independent evaluation. So when a child is on an IEP, they're evaluated every 3 years. And every 3 years, we're looking to see progress. We're looking to see in those evaluations how our kiddos are doing, looking to see if they're still eligible for special education. A lot of times some kids will do really well and get some really great interventions, and we might find that they don't need to be on an IEP anymore. But then sometimes we evaluate with the school, and you look at the evaluations and you think to yourself, this is not my kid. Like these don't, no, that's I don't agree with these. Like they don't seem like they're really kind of, capturing my child and what their areas of concern are. So if you disagree with the school's evaluation, you're allowed to request an independent evaluation at the school's expense. We also have a sample letter for that too. So if you do get to evaluation and you find, yeah, no, I feel like we need to do different type of testing or more testing, you can request that independent evaluation if you disagree with the school's evaluation.
There is a question in the chat, Maureen, if you want
Oh,
to.
sure. Okay.
Do those records extend to standardized testing? Up until this year, I was told I couldn't have them, and even now it's dicey.
Really, standardized testing. Standardized testing should be sent home to the parent too. So the parent should be getting those standardized testing. Are we talking state testing, standardized testing? Okay. Yeah, those should be in the educational record, and they should have also gone home to the parent as well. So a lot of those records that you're seeing at the school, hopefully parents already have a copy of them. You can't see teachers' personal notes and things like that. Those aren't included in the educational record, but behavior incidents are. Other things like reading tests and reading assessments. There's a new dyslexia screening law in New Hampshire. The kids are screened K through 3rd grade 2 times a year. Records like that will all be in there. So it's really, I always recommend to parents, it's not a bad idea to go in and do a record review, probably when your kiddo gets into middle school and if they've been on an IEP for a few years, it really doesn't hurt.
She actually was a little more specific. She said district testing, like Dibbles 8. Is that how you say that?
Yeah, Dibbles testing should be in there. Yeah. Yep. So they can request that. If they don't see it in there, they can request that it be part of the record. And also another handy thing is when parents are going back and forth with the school, maybe bringing in like a medical record from an outside doctor or therapist, and they want that, they always write on the bottom, I'd like this included in my child's record. And any correspondence that you're having with the team, like say, for instance, you want to request an independent evaluation and you use that letter, you could put down at the bottom, please include in my child's educational record. Because the thing about the independent evaluation that's kind of interesting, the school can say no to that. They can say, you know what, we're really comfortable with our evaluation and we stand by it. So we don't think there's a need for an independent evaluation. And in that case, you can disagree with the school and choose a dispute resolution option, which kind of goes right into the next 2 bullets there. So whenever a school, you go back and forth, you make a request, they give you their answer in writing, usually in a written prior notice. With WPN is the acronym for that one that we love to say. Really important document. And we're going to go into it a little bit more detail. But that written prior notice will explain what the school is proposing, and then you can give consent to that or deny consent to that. You don't agree. And then if the team can then usually work it out within the IEP meeting, but if you can't, you have the option to utilize dispute resolution options. And the handbook, the procedural safeguards, goes into a really nice detail about all the different options. And we also on our website have done a really nice chart that kind of outlines what types of dispute resolutions are available to parents in New Hampshire. Because there's formal dispute resolutions and then there's informal ones. Like you can have an informal one would be trying to get back to the IEP team meeting and trying to resolve it. Also a facilitated IEP meeting, which is when you would you would request the Department of Ed send a person in to listen to both sides of the story on the IEP team and help the team come up with an answer and with a solution and a resolution. And that person, that facilitator, is trained. They're not an employee of the school district. They're not an employee of the state. So that's kind of a nice option to resolve disputes. The other ones, they get a little bit heavier. There's mediation, where you would actually go to a mediation hearing, and that would be heard by an attorney, but again, not an attorney that works for the state. It's a person that's brought in from outside, and they listen to both sides of the story and try to come up with a mediated agreement that would go in writing. We always recommend that, the school's going to have an attorney there, so we hate to see our parents, not be supported too. But who wants to spend money on an attorney, right? So we try, and then the top level of dispute resolution option is the due process hearing. And that one is definitely recommended. You can do it without an attorney, but we always recommend that you do it. You can also, if you prevail, if you win, you can get your attorney's fee paid for. So, we just hate to see that. At PIC, we always ask parents, before you go down this road, give us a buzz. Let's talk about it first and see what the best option is for you. But it's there to be successful, to help parents get what they need and to resolve grievances. So it's something that definitely is, very, very helpful. Okay, next page. Then. So in those procedural safeguards and in your rights, you have a 10-day advance notice of any IEP meeting. So you always get that. We always call it the invitation to the party. You get it 10 days in advance that we're going to have an IEP meeting on February 21st, and it's going to be at 10 o'clock. And this is the list of people that are coming to the meeting. And that's great. And that's good to pay attention to, because if you have a particular concern in an area, academic area or behavior or whatever, say your child is really struggling in reading, you really might want to have that reading specialist at that meeting. So it's okay if you don't see them on the list to go back and say, my biggest concern that I want to discuss is reading. Can we make sure the reading specialist is there? Okay. Because you want to make that IEP meeting so the most productive meeting you can, because you're giving up your time. Everybody's getting there. We want to make sure that the appropriate people are at the table. Confidentiality. All your records are confidential. All your child's information, especially all their medical records and everything, is in a confidential file. Like I said, you can access your child's records at any time. You can also give and withhold and revoke consent. Revoke consent is kind of important because a lot of times we get a call from a parent and they will be in a panic because they signed the IEP. And then they realized, well, it's taken away their child's speech and I didn't know it was going to take, So we always tell parents, it's okay. It's a fluid document. You can go back and say, I didn't really understand what I was signing. I really want to kind of revoke my consent and get back to the IEP team. And I've got a lot of questions. Okay. And that brings us to that written prior notice document. So the reason why the written prior notice is so important is because it explains exactly what the school is proposing. And you can go to the next slide, Jen. I'm just trying to think. I think I have the written prior notice if I didn't do it later. Oh, I got steps in the process. I'll come back to written prior notice because I want to talk about that and why it's so important, because it really gives parent informed consent. But it's important to know the steps in the process as well, especially if you've got a kiddo that you're going to make a referral to special education because you suspect that their disability is really impacting their learning. you would make a referral in writing. We got a letter for that. And then you would have a disposition or referral meeting within 15 business days, which is nice because that's a very quick timeline, because we don't want that kiddo, if they're struggling, want to make sure we get everybody at the team and get together and discuss what we can do to help. Then the team is going to talk about evaluations. Shall we do evaluations? Do we need more information on this student? So they'll probably do formal educational evaluations. And then the parent is also allowed to bring in any of those outside evaluations their child has had. After the evaluations are done, which takes 60 days, hopefully school does them a little bit quicker than 60, but they do take 60 days. You get back together as a team and you determine if the student is eligible for special education. So the interesting thing about this is having a disability does not automatically make you eligible for an IEP. It has to actually, and that disability has to impact the child's learning and their academics. So determining eligibility with the IEP team, with you part of that team, you get to look at all the data that you've gotten. You've got classroom observation of the child. We've got all those evaluations. We've got the regular ed teacher there that's going to talk about how the kiddo's doing in class. We've got the parent that's talking about how their child is doing in school and when they come home from school. That's super important. If we have a child that's coming home bawling their eyes out the minute they walk through the door because school has just been so hard and they won't do their homework and things like that. So all of that information is so important to talk about determination of eligibility. So once we determine, yes, definitely this child's disability impacts their education, we need to develop an IEP to give them some supports and services to help them access their education. So then they got 30 days to do that. So they have 30 days to create that IEP. You all come back together again, you meet and talk about approval of the IEP. So hopefully that IEP is going to come to you a couple of days in advance so you can read through it. And especially if it's the first time you're reading through it, not the easiest document to read. You know, it's kind of little jumbled. I do a what's in your IEP workshop that I absolutely love, because for me, that was like the aha moment for me. Once I understood how the IEP works and flows, it was like, oh, I get this now. Because it's really important to have all that information that affects our child in the IEP. And afterwards, we talk about, can we implement this IEP in this placement? Can we deliver these services that are in this IEP in this student's least restrictive environment, which would be their regular school that they would attend if they didn't have a disability, just their regular school. Sometimes our kids' needs are a little bit heavier than our public school can meet. So we look at maybe an out-of-district placement. So that's when you would go through that stuff. And then there's ongoing monitoring with the IEP. So the IEP, a big part of the IEP are IEP goals. And for us parents, that's a really important place to keep an eye on, because those goals are in every area of need for your child. They should make sense to you. They should be really measurable. And there should be little short-term objectives and benchmarks that go along with an annual goal, because our IEP is annual and we want to make sure our student is making progress throughout that year. And that's when the goals play a really big role, because if they're not meeting those little baby steps to the annual goal, then we know that probably that special instruction that's attached to that goal isn't going so well. Our kiddo's not getting it. They're still struggling. So it's a good time for the IEP team to meet and say, all right, let's pump the brakes. Let's take a look at what's going on here. And why isn't our kiddo making progress? So ongoing monitoring is really important, and the goals are really important. And sometimes they're written and they just, to a parent or who's not an educator, sometimes you read the goal and I'm like, I don't get it. And it's okay to say that. Say that, what exactly does that mean? And what's that look like in the classroom? And so definitely ask as many questions as you want. Okay, next slide. So the referral, like I said, is that first step. You make the referral. Most of you guys, possibly your kids are already on IEPs, so you've been through referral. Another thing is if a student is on a 504 plan and you find that the 504 plan, they're really struggling and you really feel like they need some specialized instruction somewhere to help them with school, that's when you might want to make a referral to say, the 504 is great, but it just gives you accommodations. It might give our student extra time on tests. It might give them an ability to get up and leave the classroom if they're starting to feel overtired, if they're starting new medication and they're exhausted and it's a long ramp up and they're just not up to their normal speed. Those accommodations will allow them to be able to go take a break during the day. And that's fine if that's all your student needs. But if they need a little bit more than that and they need specialized instruction in multiple areas, it could be academics, could be social and emotional, it could be behavior interventions, there could be a load of areas that the IEP can focus on. It doesn't have to be just academics too. Okay, next. So the disposition, like I said, just went through these steps, so I'll go kind of through these a little bit quicker. 15 business days, should the child be evaluated or not? And then the next one. So the IEP team decides, like I said, in those steps, you guys are going to be the ones, and you're part of that decision. If we feel that, like I said, that disability is not impacting the child's academics too much and they just need accommodations, then the team right then and there could consider a 504 plan instead. The other good thing to know is if they did consider a 504 plan and you do that for like 6 months and you're really struggling, you can make another referral. You can keep referring. Sometimes the IEP team decides, hey, our kiddo is really kind of struggling, but we don't think it's a learning disability or anything like that. And maybe some intervention can help that all students get. So they might decide to do that too at this point. But again, it would have to go into writing. So I always tell parents, make sure whatever the school's proposing goes into writing and goes in that educational record. Because if you do make a referral, like sometimes a year later, or I see some parents, first grade, they might start with a 504. And then all of a sudden, second grade, just things are really, wheels are coming off the bus. It's just not going well. They make a referral to special ed. I think it's always good for the team to see that they had gathered before and thought they might need an IEP before, but we went with 504. So it's that educational history. It's that whole history of, we've already been down this road with a 504, so we think an IEP is going to be more suitable. Next slide. So the written prior notice. This is when I'm talking to parents on the phone, and they're in a disagreement with the school district. Usually the first thing I'll ask them for is this written prior notice, because it helps me to see what the school has proposed. And then I can help the parent do a counter proposal, if need be. So the written prior notice, it comes anytime you do an evaluation, you make any change to the IEP, you're going to change a student's disability category, you're going to be changing the student's placement. Anytime you have those big discussions and make any change to that IEP, a written prior notice should be given to you. Sometimes it's given to you at the meeting. Sometimes it comes in the mail afterwards. But the important thing about this document is this is what's gearing you up and giving you informed consent. So if this makes sense to you and you agree with it, then you can sign, I agree. If they propose this, and it's always a proposal, like it looks like it's a decision, but it's really not. It's a proposal because you always have the option to disagree with that proposal. So that's important to know too. But the written prior notice answers like 7 questions, and it's great. So it gives the IEP team is proposing what we're doing. We're proposing to change a student's placement. Reasons for the proposal. They'll say the reason why the IEP team decided this because our student is really struggling, needs more supports. The school is exhausted every support they could use for the child. The team is considering a different educational placement. Then they have to answer what documents the decision is based on. So they can't just say, oh, this kid's too hard to educate, or they have to show actual data. So they have to show you the documents that support that decision. So we just can't make a move on a kid. We just can't change our kids' IEPs without data supporting that. So in other words, if a kiddo has speech 3 times a week, we can't just all of a sudden decide we're going to change it to 2 because we only have 1 speech pathologist this year and we're really short-staffed. That can't be a reason. And they would never put that in a written prior notice because they know that can't be a reason. But that's why there's always got to be documents and data to base that off of. Then they have to talk about other options considered. So other options considered, the reasons why those options were rejected, because, the team goes back and forth with different suggestions. Other factors discussed by the IEP team. What else can we do? And also an acknowledgement that information about your rights was provided. So the procedural safeguards, right? So those are your rights. You can disagree with our proposal if you'd like, or you can agree to it. And then they also should throw in like PIC's name there for you to call or someplace to call to be able to ask questions about that. So the written prior notice, really, really important. Always tell parents, ask for a written prior notice. If you didn't get one, you can go back to them and say, hey, we made a pretty big decision to change the IEP at our meeting last week. I'd like a written prior notice for that. Okay. Next slide. Evaluation is the other step that we talked about. You folks have to give consent for those evaluations. So again, decisions are made and they're data driven, and evaluations are a big part of obtaining that data. Initial evaluation must be completed in 60 days. But like I said, you can have reevaluations every 3 years for kids who are on an IEP. And important to notice too, if your kiddo is really struggling and they haven't had an evaluation in 2 years, you can ask to move up that 3-year evaluation and do it right away, because sometimes we just need that information. For a reevaluation, you can extend it for 30 days. So a reason why you might want to extend it, it could be through the holidays. I had one kiddo who was not very compliant when he had to be evaluated. And he was always, he'd say, go to the boys' room and he'd never come back. So, sometimes they're sabotaging it. So I would sometimes have to give an extension for him because he was challenging to get evaluated. They must send all of the copies of the evaluation reports to you at least 5 days before the IEP meeting to review them. And that's really important, because if you've been in a meeting and they hand you an evaluation that's hot off the press and it's 25 pages long and you're supposed to read through this while you're in the meeting, disaster, right? Not a very productive meeting. We also have another great tool on our website under that resource tab that's called the data evaluation sheet. And I love this sheet because it kind of allows parents to walk you through evaluations and pick out what are recommended, what's important, what the students' needs are. It really helps you dissect an evaluation if you're not familiar with them. Also, they have to be used with a technically sound instrument. They have to be very formal. These evaluations, they must talk about what the environment was like with your kiddo. For my son who has a seizure disorder, if you put him in a room with fluorescent lights and very bright room, he is not going to do well on an evaluation. So it's important that they describe the environment that the test was given, and they stick to the formal. They have to really stay with the protocol when they're given these tests, which is great when that's the way it should be. So next slide. So they have to be non-discriminatory. So they also have to be in the student's first language. They identify really the special education and related services. So usually, the evaluations will show us if our kids need any type of, related services support, such as, academic support. They need maybe counseling support during the day. These evaluations are going to tease out those needs. They also tell us what level presently are our kids at. So where are they at right now? And how's what can they do academically, and what can they do functionally too? So it's going to talk about everything from how our kiddo learns where they're at and how they do throughout the entire day. How do they do maneuvering through the hallway, at the lunchroom, recess? So it's really going to look at everything about the whole student. They have to be administered by a certified licensed personnel. So the person giving the test is usually a school psychologist. Sometimes special education teachers are certified in different areas that they can do testing. And also in a language in a form that most likely yields accurate results. So if our child is nonverbal, we want to make sure the testing is nonverbal. Okay, next one.
Maureen, there's a question in the chat that says, our school says 2 days prior for results of evaluation, and you're saying 5.
Yeah, it's 5 and it's in the rules. And I'll tell you, it's funny. I was part of the stakeholder group. We used to do evaluations in New Hampshire in 45 days. That was awesome. We were like the only state that did them in 45 days. But the school districts pushed back on it. And when the New Hampshire, we have state laws that coincide with the federal law, IDEA. We also have state laws, which are the New Hampshire rules for the education of children with disabilities. And those state laws can only go above and beyond federal. So we used to go above and beyond federal by having evaluations done in 45 days. But the federal says you only have to do them in 60. So we changed it to 60, but the bargaining chip was you got to give those documents to parents 5 days before, because that's just not fair. So it might be the IEP can get to them 2 days before, because the IEP is really not included in that statement. So the IEP might be the one they're given to you 2 days before, but evaluation should be 5.
And they just said they're in mass, so that 5
Oh.
is that
Okay.
the federal?
Mm-hmm. And that 5-day is not applicable to Massachusetts. So I apologize. I forget we have people on from all different states. So I should definitely mention that. So that's kind of a New Hampshire thing, the 5 days before. Thanks for bringing that up. Okay. And the next slide. So after evaluations, like I said in the steps, we're going to determine eligibility. And eligibility can be from the age of 3 all the way through to a child being 22. And that just changed recently too in the state legislature, which is great because it should have been through to 22. As long as the student has not received their regular high school diploma, they can stay in school up to 22. Even, they could stay till 19 and 20 and 21, but as long as they don't receive that regular education high school diploma. Once they get that, they're done. Graduation and special education ends. They must have a disability that requires specialized instruction. That's kind of the big difference between that 504 plan and an IEP. An IEP is the student really needs specialized instruction in a certain area where they work either one-on-one or a small group with a special education teacher to close a gap of an area of need. So specialized instruction is the big difference. And they must receive written prior notice. That happens too for eligibility. And the next slide. Here are some of the eligibility categories. I won't go through all of them. They're kind of, they're easy to understand for the most part. But for our kids with seizure disorder, that would often be under other health impairment, which also kind of loops in other medical issues. If our kiddos have anxiety, depression, things like that, any kind of medical issues that are diagnosed by a healthcare provider, other health impairment, ADHD is often put in that category. But you can see the rest of the disability categories. And usually important to notice, like people can sometimes get like, my child doesn't have the right disability category, but these disability categories are really for the state to be able to look at us as a whole state and find out where and who has certain disabilities and are we funding that school district enough. It should not drive services in the IEP. So, I always tell parents it's okay if, specific learning disability is the category, but the child could be dyslexic, but it doesn't say that. But it's okay because it can say that later in the IEP. So, okay, next slide. And of course, my landline only goes off when I'm doing a presentation, but Development of the IEP, like I said, then we go right into that. They have 30 days. And this is what we talk about. Kids with disabilities, and an IEP entitles a child to a free, appropriate public education in their least restrictive environment. That is what an IEP does. And often you'll hear the terminology FAPE. So is our child getting access to that? That's what the IEP does. It allows them to participate in that school, in that classroom, and access that general education curriculum and be able to make progress. So that's what FAPE is. So free, appropriate public education. And then the next slide, a few areas of the IEP that I just want to talk a little bit about so you guys know what to pay attention to. Present levels of academic achievement, functional performance, make sure that makes sense. You know, sometimes, and I'm not saying this, but occasionally the annual update of the IEP, sometimes you'll notice that at present levels are kind of staying the same all the time. And it's like, no. My child's no longer having a meltdown when I drop them off every day. We're kind of over that, you know, but it might still be in there. So always check that and read that, because sometimes it just can be carried over from the previous era. Make sure it's up to date. The extent to which the child will be in their regular education classroom. If your kiddo is going to be removed from that regular ed classroom, we want to know why and how often, because the goal is for them to be in the regular ed class. So if they're going to be removed, we want to talk about where and why and how often. How progress is measured, that's the goals. You know, pay attention to those, definitely. And actually on the goals, it will actually say right below the goal, method to which progress is measured and reported to parent. So make sure if it says quarterly progress report, you're getting those progress reports. And you can have them more frequently than quarterly. That's just the most common. They usually come with the report cards. How and when you'll be informed, whether it's progress report or not. Transition needs for older students. That's a big part of the IEP for our kids who are in high school. When a student in New Hampshire reaches the age of 14, we start to do transition planning. In other states, Massachusetts too, in other states, federal says you don't have to start till you're 16. But I think 14 makes so much more sense, because that's the age our kids are just starting to enter into high school. And the transition plan really looks, it's almost like a mini IEP within the IEP. And it's all about what our student wants to do for life after high school. And it is completely student driven. It's based off of an interview with them. They're the one that sets the goal. So if they say, I want to go to a 4-year college, that's their goal. And then we develop this transition plan to help the student reach that goal. If their goal is that they want to go to tech school, they want to be a vet tech, they want to pursue, something in a career technology school and do auto mechanics, things like that. Whatever's in there, we're going to choose a goal every year. The student's going to be updated every year. Do they still want to do that? Because who knows what they want to do at 14. So that often changes every year. But the transition plan becomes a really big part of the IEP in high school. And there's a lot of great options out there for our kids to participate in transition planning. And you want to make sure, I could do a whole just workshop on just transition planning alone, because it's really kind of a unique part of the IEP that I love. And when it's done really right, it's dynamite, because it really helps kids. Length of the school year, parent concerns. So this is another really important part of the IEP that is, I don't want to say often overlooked, but sometimes, yeah, it is not. You want to make sure you fill that out. And it's on like the second page of the IEP. And it should be annually updated. And it should talk about what your concerns are and what your goals are for your student that year. So it shouldn't be a complaint list. It shouldn't be a laundry list, but it should be like, if my child is struggling socially and emotionally, this year I want to see some growth in that area. I want to see them making friends. I want to see them, getting more active in after school extracurricular activities, things like that. Whatever your concerns are, put them in the IEP, because like I said, you are the history. You're the educational historian, right? You're the one that's tracking what your concerns are. And, that helped me a lot. My child really struggled in math, and I kept saying every year in my parent concerns, I'm really worried about math. Math is not going well. We're not doing. So when it came time to get them a tutor in math, I went back and said, okay, for the last 6 years, I've been saying this is a concern. So they really couldn't argue, and they kind of had to do the tutoring because I had already put that in there so often. And it's a legal document. It's good to have your writing in there and your opinion. Okay, and the next one, approving the IEP. You have 14 calendar days to take that IEP home, any document they give you to sign, and read it over. If it makes sense to you, look at your written prior notice. If you want, call PIC if something doesn't make sense, or go back to your case manager and your IEP team. You provide consent. You can give partial consent, which means you agree with most of the IEP, but there's a couple of sections here that you're not quite in agreement. So you do partial consent, and you really put in writing what you disagree with. And then you go back to the team in 21 calendar days and have a meeting to discuss it. Also, you can have another meeting, and you can also, if you just can't make that resolution, you can pursue a dispute resolution option. And then the next one, placement is determined, as we talked about that. Least restrictive environment. There's a continuum of placements. There's a couple of different options for placement. And, there's regular school, there's private school, private special education school. There's a resource room that a child can have a placement in. And also, if a child has to have home instruction for some time, if your child is really having medical issues and they need to be instructed at home, that's an option too. And then the next one, monitoring, we already kind of discussed. Formal review at least every 3 years. The next one, Jen, we can go right past that. Always, I always recommend to parents to show up with an agenda. That's really helpful for me. Write down what your concerns are before you go to that meeting. Have that agenda added to your child's educational record. So you can so there's a record there of what your concerns are and what your agenda was for each meeting. Hugely important, because once I get talking, as you can tell, I get off time. So it's always important to have that agenda and document everything in writing. Okay, and the next one, go ahead, Jen, that's fine. Clear and effective communication. Make a list of your questions before the meeting. Problem solve them together. And that is the biggest thing. And once my team understood that I was going to show up with an agenda every time, it got to be just part of the meeting. It was like, okay, Maureen, let's go over your concerns. I'm like, okay, great. And I chip them all off as I went through, which was great. And then a follow-up after every meeting is also great advice. Yes, because I always sent a thank you, but it was really my way of just reiterating what we agreed on. Like, hey, thanks for meeting with me today. And as we discussed, we're really going to check in on that reading level and maybe do a Dibbles test to see where the reading level. And it was just, and then I would say at the end, if I've missed something, or if you guys don't agree with this, please feel free to write back. So the thank you is so important, because I think it just helps everybody, because they're busy. They've got a million different IEP meetings, but you've got one. And if you can kind of stay on top of that team to make sure, because I don't think it's not, they all have good intentions, but occasionally, schools get really busy. So it's important to kind of keep track of what they're working on for you. And then the next slide, just a few sample questions I threw in. How can I support my child? You can provide me more information. Regular communication. If you want to be progress monitoring.
Maureen, we have a question too in the chat.
Yeah.
And it's from Emmy. Emmy, if you want to unmute and ask the question yourself, you're welcome to do that, because sometimes you're able to provide a lot more information than just what you can put in the chat. So please unmute yourself and ask your question. That's a very important.
Yeah. And I'm happy to wait until it sounds like she's kind of coming to the end of this section. So I'm happy to wait.
Yeah, no, go ahead, Emmy, because it's okay. Basically, I've only got a few slides left that are pretty generic. So,
okay. So this goes back to kind of the least restrictive environment. And you said that, there's a possibility that if they're not able to meet your child's needs, there could be private school, there could be this and that. So we live in a fairly rural area. The only private schools we have are even more difficult and selective than our public schools.
Mhm.
And my child has not a diagnosed learning disability in math, but we're working on getting a diagnosis for a learning disability in math, but she's been behind since first grade. She's now in fourth grade. She's currently at least a year behind, and she keeps falling farther and farther behind based on standardized testing. She's not meeting her quarterly goals.
Yeah.
She's got pull out 5 days a week in math. I have argued that the curriculum is inappropriate for her because I know that she doesn't learn in the spiral curriculum. I know she works in a mastery. They're like, yeah, but she needs to be in this regular classroom. Um, we're going to do this pull out. She's pulled out 10 times a week for math, before math and during math.
Okay.
And she's still not making progress. So, but we don't have the option to be like, we're not like Boston where we can be like, oh, let's go to this special school for kids with dyscalculia.
Right.
It's literally, I have my school district. So like, what do you do? Like, do you have suggestions for how to approach that?
Yeah, and as a matter of fact, both of my kids had the same thing, dyscalculia. And it's brutal because, there's a lot of interventions for reading, but when
Oh
math
yeah,
is just like, oh my gosh. So
there's nothing.
so I'm with you. It's difficult, right? Because you're right. The general curriculum class is really just not the way they can learn math.
No.
And it wasn't helping. So with the data that supported that this has been a concern, we weren't making progress, just everything you said, like you're not making your quarterly goals, you're not, your standardized testing is extremely low. That's the data you bring. And we had to actually bring in a math tutor, kind of an expert on math learning disabilities. And my kids worked with that person almost at the same time. And so they would go to class, learn a little bit, in class, then they would go with the tutor, and the tutor would try to, take what we're learning in class and then putting it into their language, and how they learn math. And that's
Right.
basically,
And that's what she does with her special educator this year. And her special educator is really wonderful, but the issue is in fourth grade they're learning to multiply uh, mixed numbers, so like a whole number and a fraction.
Yeah.
It's just you need a certain amount of prefrontal cortex and abstract thinking to do that, and my daughter does not have that. Thank you, seizures.
Yeah.
And so it's like it's kind of we're at the point where no amount of tutoring is going to get her multiplying complex numbers or mixed numbers. And so my argument is, why are we spending time on this? She really should be spending time on things like multiplication of whole numbers, which she still does not have.
Right.
And they're like, yes, but we need to keep her in the regular classroom. We need to keep her with her peers and only pull her, with on the same curriculum as her peers. And so,
right. And as you can see, like that's what the law states, right? And the law is there to protect kids, so to make sure the school keeps up and they don't all get behind. But you're right, when you're in a situation like that, and we were in the same situation because math is building on, right? And it is like being on a treadmill and you can't get off, and the poor kiddo is back here so we really had to work with that tutor pretty much exclusively to try to close that gap of fundamentals. And then what we would do is we would also take what was being taught in the classroom and say, for instance, they were starting to use negatives. And it was like, oh my gosh, we're having a hard enough time and, not using negatives and positives. So they would make the actual calculation not as intensive for my kids, so the numbers would be easier for them, but they'd still be learning the same concept.
We're struggling to get them. They were refusing to give her separate assignments. So was that tutor at the cost of the school district?
Yes, absolutely.
Okay, because we cannot afford a tutor. Like that is not
nope.
that was not in the budget.
That was at the cost of the school district, and she ended up being just tremendous, but they had to go outside of the school to hire her because there was nobody in the school district that could do it. And luckily they found her, and she ended up just being absolutely terrific. I mean, even my son wrote his college essay about her. That's how great she was, because she was like the first person that could make that connection for him. It was really, but keep trying and keep working. And you're right on. You're exactly, that's what should be happening. She's got to get those fundamentals first, and then they want to say modify, but it's not really modifying. You're just accommodating the curriculum to her level. It's like
Right.
when, giving a student who's reading at a 4th grade level, but they're in 6th grade, giving them a textbook at a 4th grade level. You can do that, so
Mhm.
they should be able to adjust and work with you. But that's, it's,
And
it's
Emmy,
tough.
I
Mhm.
will reach out to you because I have some other questions too about, does she have an IEP?
Oh, yes. And it's
Okay.
large.
Okay. So she has math goals, right? On her IEP,
Yes.
her learning
Yes.
goals.
And she is,
That
yes. And
is
she is
what
not
should
meeting
be,
them.
okay. So that's, if she's not meeting them, then you can call another IEP meeting and
Yeah.
say, she's not meeting these goals. These are not appropriate goals because she's not meeting them. So we need to go back to the drawing room and we need to come up with new goals because if she's not meeting those, and it's okay. So like my daughter, Emmy, is 17 and she's functioning at a 1st grade math level. So
Mhm.
her math is not going to be 17-year-old math. She's not doing algebra.
Right.
She's not doing, geometry and physics and all that kind of stuff. So she's relying on life skills. So they're teaching her how to use her calculator, how
Right.
to, life skills stuff, making sure she can read an analog clock because sometimes in businesses she may need to read an analog clock. Like, so you can actually, yes, they don't have to use the curriculum that they have. And Maureen is exactly right. We did the same thing.
Yeah.
We brought in a tutor for our daughter. So I live in Maine and we're rural. And I
Yeah.
did this thing. Her tutor's online, it's virtual, which actually works out great. And she ended up doing a specific program called the Linda Bell program with my
Oh,
daughter,
that's nice.
which,
Yeah.
it's an amazing math.
Okay.
It is great for our kids because it requires multi-sensory approach for learning. So it's
Right.
using touch, it's using all your senses to learn, which is what our
Yeah.
kids need. Because just like Emmy, just like my daughter's the same way. Her seizures has just ravaged her brain, and it's the same thing. So, but call back another IEP meeting, bring all of that paperwork that you've seen in that documentation, document, because that is going to be your best friend because they can't deny something if you're able to show all the documentation. So I would call another IEP meeting. I would bring in and say, okay, these goals we're not meeting. Look, she's still not meeting these. The testing shows
Mhm.
this. Figure out when she was last tested. Ask again for more testing if you need to have
Yeah.
her
And a deeper
evaluated.
dive into math
We have,
testing. Yeah.
yeah,
Absolutely.
we have a external neuropsych evaluation because she gets evaluated through the hospital every 2 years for neuropsych just because of seizures to measure her cognitive. And we have that meeting on Friday. So I was going to call an IEP meeting, but it was like, I can call an IEP meeting, but I feel like I've reached the end of my options with this district that they're willing to provide because they say like, oh, she's fine. And I'm like, yeah, but she's not meeting her goals.
Right. And that's
Oh, but she works so hard, but
I
she's not
know.
meeting her goals.
Right.
Yeah, exactly.
But
And
but
that
we need
also
to keep her with her peers, but she's not meeting her goals. This is what has been happening for 2 years.
Yeah. And
So
it's the best thing to indicate that the specialized instruction that she's getting in math isn't working. So you'll
yeah,
see the goal, and then you'll see in the related page, it will say, specialized instruction in math, and it's tied to those goals. And
yeah,
that she's not meeting the goals, and then that specialized instruction isn't working for her. And they've got to really,
okay,
and you could do an independent evaluation too, might be another idea, is to go to somebody, and that's what I did too, is kind of went to an expert in learning disabilities in the area of math, and I had that person evaluate my son because
yeah,
he just looked at it from a math perspective, and he was like, oh yeah, we've got to change the whole way he's learning math because he doesn't get it this way, so we got to do a different approach. So definitely,
okay,
yeah.
yeah. That's on our list of to dos. I have the name of somebody who can do that. It's
Good,
just
good.
it's getting in and it's affording the
Oh.
several $1,000s that it's going to cost
Well,
to get
if
that
it's an
done.
independent evaluation, you can ask for the school to pay for it. Because if they're not meeting her needs, right, and she's not,
Mhm.
then an evaluation is really what the school and you guys need to determine how is she learning math, to learn more about how her brain is working. And that should not be paid for by you because that's going to be used to create the IEP and to determine what type of service she needs. So the school
Okay.
can actually pay for that. So request an independent evaluation and just say, you know, you guys have been great, but I think we're going to go outside for some more real specific math testing. There's Key Math. There's a Key Math is a great math test that Key Math 3, I think it is, that looks at kids' number sense. Like you got to start
Okay.
there, right?
Yeah.
Is it? So definitely, you know, independent evaluation, have them pay for it, and then say, we need a real specialized instruction person that can
Okay.
teach for this. Yeah.
This is helpful. This is all stuff I'm like, I feel like this is what I should be doing, but you know, until somebody's like, yes, you should do this, it's hard to
Right.
ask for it.
Exactly. Exactly.
So, thank you.
Excellent. Good. And then just I'll through the last couple of slides too, the sample questions and using productive. This stuff is pretty easy. Ask questions, manage your emotions, rephrase for clarification, say thanks, do that thank you notes, always handy. And then the last, we should be getting to the end there, Jen. Let's see. If it's not in writing, make sure everything's in writing. So that we can't say that enough. We have t-shirts in the offices, like, you know, make sure it's in writing. Focus on one or two issues. Sometimes it can be very overwhelming when we have kids that are really struggling and there's so many needs, but just try to take it, chunk it down, take it one at a time. And always set a deadline for reply and make sure everything is dated and signed. And then the last, I think I have one more. Yep, there it is. So definitely just, you know, a little bit about our resources, but definitely, you know, feel free to reach out to us if you have any questions about your IEP team or something you might want to ask for, or how do I go about, you know, saying we're not making progress. You know, it's a difficult conversation to have, you know, with a group of professionals. So it's definitely just give us a buzz. Any other questions?
Well, I think we're good. I think the chat, we can't say thank you both enough for being here tonight, Maureen and Jen. This is something that when I work with my families, I scream to the rooftops. Your parental letter, make sure you write your parental concern letter before every meeting and make sure that's in the IEP.
Exactly.
Because it's so important. It's those little things that as parents, and I didn't know that any of this
Yeah.
until we had to take our school district through due process.
Yeah.
Because we realized they weren't meeting her needs. And it was an advocate that worked with me that I was like, I had no idea. And I was a teacher for years and didn't we're not taught that a lot of the times in our schooling. So
yeah.
it was very eye-opening. But
Yeah.
being an advocate for your child or you know, if you're a guardian in any way possible is so important. And we know that Maureen and Jen, if families are not from New Hampshire, are they still okay to reach out to you, just to ask questions and maybe even put them into the right resources, or have you?
Yeah, absolutely.
Okay.
Like you have your own
Wonderful.
in Massachusetts, there's the Federation of Children with Disabilities, and there actually might be even two of them, two picks in Massachusetts. But every state has one. But we're more than happy to answer any questions. Just that sometimes you can see the state laws might change a little bit, but always happy to answer anybody's question and direct them to the right resource. Absolutely.
Thank you guys so much for being here with us tonight. I so appreciate it. From a mom with a child with disabilities, you know, we have to band together because I say all the time, like the schools do not tell you this. Like it's almost like it's hidden. And you have to educate yourself, but it's a lot as a parent to take in and know
It is. It's a
what's
full-time
right and what I
job.
should be doing. So thank you guys so much for being here tonight. This is recorded, so I will be sharing it with everybody that was on the call. And have a wonderful evening. And we look forward to you guys next week for our next webinar. So thank
I have
you
a
guys so much.
question.
Oh, go
I have
ahead.
a question, but nobody has to stay on and you can stop recording if you want.